Welcome back to the Interviewing People Career Cast, featuring highlights from the full-length interview with Kailey Gilliland, a sonographer at Wood County Hospital. In the highlights, Kailey shares what a sonographer does, the educational options she had, what the most difficult and rewarding parts of her job are, and much more. So sit back, relax, and know you can always go back to watch our full interview if you'd like to learn more. Enjoy the show.
I believe about my sophomore year in high school is when I discovered this career path, and then I kind of just never changed from that. Really liked it. When I did do the shadow day in high school, that's when I definitely really fell in love with it, actually being able to see it hands-on. I still remember to this day on shadow day, when I was sitting in the back corner watching them do the ultrasound. The very first patient that I had seen get her ultrasound done, she was actually finding out, I went to an OB office, so she was actually finding out the gender of her baby at that ultrasound. And she already had two girls. And so for this third one, she found out she was having a boy. And she just started crying. The room was all emotional. And then that's just kind of when I fell in love. I'm like, yep, this is what I want to do. Around here locally, the University of Findlay does have an ultrasound program as well as Owens. The reason I chose the University of Findlay though was because the Toledo campus, the Toledo Owens campus is the one that offers the program, not the Findlay. Just me and my personality, I'm more of a homebody. So that's a huge reason why I chose the University of Findlay. And I actually was the University of Findlay has an excelled ultrasound program. So I did get my associate's degree, but I actually was able to finish it in a year and a half, just a little bit shorter. And the difference between the University of Findlay and to Owens, from what I've heard from other fellow sonographers, the difference and a huge difference is the clinical rotation. So the University of Findlay, they do their clinic rotation. You have one site that you go to, and my site happened to be Tiffin Hospital. I really liked Tiffin, but you stay there for the whole, I think it's 16 weeks if I remember right, or however long the clinic rotation is. Where Owens, you actually go to multiple hospitals, multiple facilities. You do your rotation in 6-week increments, or maybe 3. I honestly can't quite remember what they've told me. So that's kind of something to take in consideration, how you would like your schooling to be done. If you're okay with just a one site, getting to know their schedule, their routine, it's awesome. I really liked it at Tiffin. As opposed to going to Owens, you'd have a lot of different experiences, different types of offices to go to. And yes, I did get my associate's degree. I to be completely honest, just didn't want to go to school for 4 years, just where I was at in my life, my personal life and stuff like that. And the difference between associates and bachelors in the ultrasound world is the bachelor's sets you up to be able to teach ultrasound, if that's ever anything that you want to do further on down the career. And so as far as skill level and knowledge, there's not a difference between associates and bachelors. It's just whether or not later on down the road you'd like to teach it, which would be definitely awesome. But you can also go back for your bachelor's too. So that's why I chose the path I did. Actually, while I was still in college, while I was still in school finishing up my clinics, I had a job offer to go to ProMedica Toledo Hospital, the maternal fetal medicine department, which is in the OB side of things. MFM are what we call the big dogs. So are very knowledgeable when it comes to diagnosing abnormalities, whether it be fetal or dealing with maternal maternal issues as well, like diabetes, hypertension. If mom was born with like a heart defect or anything like that, that warrants them as high risk pregnancies. So a normal OB office, like in Findlay area, if they're doing an ultrasound and they happen to see that something's a little off with the ultrasound, something doesn't look right on baby, then they send it to MFM. They send it to maternal fetal medicine. So right out of the gate, that's where I headed. It was a little intimidating, but I learned a lot, and I learned it all hands-on. So the fetal neurosonogram, that's ultrasound of the baby's brain. So while the baby is still in mom's belly, in the womb, they do an ultrasound of the brain, and it's a lot more detailed as far as you look at so many different cerebral structures. You measure things, stuff like that. That's a little bit later on in pregnancy that's done, because that's when the brain's nice and grown. The echocardiogram, that is the fetal heart. So we look at a lot of different heart views, a lot of little heart views, checking to make sure that the blood's going the way it's supposed to, that there's no breaks, no holes, nothing like that in the fetal heart. And then amniocentesis, that is when they take a sample of the amniotic fluid inside of the belly, inside of mom's belly, where the baby is like encased. Yeah, encased. And the reason that they do that is to do even more precise genetic testing, to make sure that it's not the placenta that's throwing off some genetic testing, and to make sure that it is coming straight from the baby. And it's just a lot. It's more specific, and you could definitely get some more solid answers. It is definitely emotionally challenging, because technically us as sonographers, we cannot diagnose anything. I mean, we are taught what to look for, and if it looks like this is what it is. For example, like Down syndrome, there are certain markers that we look for on ultrasound, so we normally have a pretty good idea. But so that does pose a challenge, because especially at the maternal fetal medicine office, they already have an idea that there's something that's going on, because they were sent to a specialist for a reason. So a lot of times they would already kind of have an idea of what was going on. The office would tell them why they were being sent. So then they would ask us, like, are you seeing what they're seeing? And it's, like we can say, well, yes, things are looking similar, but it's not like we can say this is what it is. And so then, you definitely have to deal with sometimes first-time parents finding out something traumatic like that going on with their pregnancy, with their baby. But it doesn't matter if they're not first-time parents, it's still just as emotionally challenging. So you definitely have to have compassion with this career. I could not even tell you how many hugs I've given new moms, how many times I've had to give tissues to the dads. It definitely can be a roller coaster ride. But then on the other side of things, it can also be extremely exciting for them, finding out that they are pregnant, finding out what they're having. 'Cause we deal a lot of times with patients who go through IVF, which is, in vitro fertilization. So they've had troubles getting pregnant. And so then that's always exciting too. We follow those moms pretty closely, because we have to see, we have to do their ultrasound every so often to see when's the right time to do the procedure, things like that. You definitely do want to make good connections. I mean, not even just in sonography, but just in your career in general, because so Wood County and Blanchard Valley, I got both of those jobs from previous people that I worked with at MFM. So definitely don't create any enemies when you're in the work field or in college, anything like that, because, they can come back to help you in the end. So that's something I've definitely learned. Both the jobs I have now have been thanks to, the relationships I created at MFM.
Thank you for watching this episode showing highlights of the latest Interviewing People CareerCast with Kailey Gilliland. And to make your Mondays better than ever, subscribe so you can hear more career stories from those who are actually doing the work. Thank you for watching, and as always, remember that the best part about Mondays is interviewing people.